Namaskar everyone, Dr. Manish here, and now we are in the part 2 of complex case, chapter number 14, tumor of left ovarian region. So I hope you must have watched my part 1. Who have come directly to this video, I would urge that please go back and watch the part 1 of this lecture and come back to this part. So now we'll come directly where we stopped in the part 1. Let's talk about this case. I hope you must have turn your mind and start thinking about it from this case. So we did it from here till here. Status quo, no improvement. What to do? Zoic remedy already given. Remedies based on totality already given. What else? Whenever you get stuck, you reanalyze, go back to the case, and especially you go back to the original case, means the case that you took first, and see if there's something which is missing, which has not been addressed. I'm coming back to the analysis part, which we did in the first case, initially, after the knee. So what we learned there, it's a left-sided remedy. The complaint is left-sided. Uterine affection, liver is affected, night aggravation is there, vaccination is there, vaginal injection, and of course psychosis and things. Out of this, almost everything has been addressed, leaving only one thing. And what is that? I hope you know that. The liver. Liver is affected. Remember in this case. And there's nothing done to detoxify or to help the liver or address the liver complaint. So, organopathy. The organ affected. That is the one of the crucial part and aspect of Burnett's approach, is that he gave utmost importance to organs affected. Many times we are only guided by signs and symptoms. Yes, we are guided by signs and symptoms, but many times body cannot express it, or the symptom that patient is saying, we are not able to understand. For example, in this case, she was having a facial acne. Suppose this patient was not so complicated case. The same case has gone to an homeopath. He would have started treating facial acne, take his totality, constitute his mental symptom and give a remedy. It wouldn't affect. You know why? Because his actual problem with the facial acne was not the facial acne, but it was a referred and disturbance of uterine region. So when we understood that, and then slowly and steadily, this was addressed. The organ was addressed. The facial acne got better. So in the same term, we have to scan the body. We have to scan the patient's entire body, especially the major organs like liver, kidneys, spleen, heart, lungs. There are 4, 5, 6 major organs. There has to be addressed. There has to be looked down. And of course, today we have got help of a lot of investigations. I'm not advocating that you keep doing a lot of investigation, but we need to have a clinical background. Somewhere very nicely Burnette has said in tumors, tumor of Burnette, that the pathologist of today can really become a good homeopath. So your pathology has to be very good. What organ? It's like you are a homeopath, but you are in a body of an allopath. How does the allopath think? Which organ affected? What investigations? Clinically, where is the problem? We have to develop that acumen. And sorry to say that the teachings of homeopathic system is going on the way in the last few decades, which I have seen. It's very saddening that we are being completely drifted from pathology point of view, the clinical point of view. Homeopaths don't think about those things, don't address those things. So Burnett talks about those things. Let's get back to this. Liver is affected, which is not addressed. Left-sidedness is also there, which is also not addressed. And here he gives Schionanthus americanus. Now, before I go into the remedy, why he gave and all that thing, let me tell you, see, I'm not an advocate of therapeutics. I'm really not an advocate of therapeutics. But there are certain conditions, like when you talk about liver, when you talk about gallbladder, when you talk about spleen, when you talk about kidney, there are specific remedies. I'm saying specific remedies. Mind you, I'm going to explain what I am trying to say. Though it looks like a specific or group of remedies affecting that, it was not going to work until the bold and the italics or the individualizing symptoms of those specific remedies are found in the patient. Now, problem with these remedies are that these groups of remedies are that they are not well-proved remedies. They are very rare remedies or used in a mother tincture form or some combination form. People have misused it. The boric, basically, when we talk about boric is a very important book for organopathy or pathology when you're talking about. So Burnett had it own, he kept on adding the remedies for liver, gallbladder, spleen, uterus. He kept on adding. And it is not just specifically adding the remedies, but he minutely observed the clinical symptoms. From wherever he got, he addressed it. He looked it. He made note of it. And that's how, step by step, he went. Now, when we read Cionanthus, there is one remedy called Chionanthus. That's a different one. This is Cionanthus americanus. And what comes up here is, this is an organ remedy. It is predominantly a left-sided remedy. Anemic patient where liver and spleen are affected. Spleen all up to left side. Pain all up the left side. So everything left side, left side, left side. So it's a liver remedy. Liver is on the right side. But it's a liver remedy. Liver and spleen both are affected. So liver affected and left-sided complaint. How beautiful. Wow. It's amazing. Liver affected and left-sided complaints. Think of Cionanthus. So Cionanthus is the organ remedy. Now, right side. Now, liver is affected. The complaint has to be on right side. This is the characteristic. Liver is affected. There has to be complaints on the right side. But our patient says what? This patient, that his liver is affected, but problem is on the left side. Right? And that's how the remedy Cionanthus. So in Boric is such a good book that you should read these small remedies and try to find out associated. These one-liner, two-liner, underlines, bold, italics has to be looked at. So now Cionanthus basically is used where liver is affected and spleen is enlarged. When liver and spleen both are there and you have predominant symptom of spleen and the pain in the left side, Cionanthus is one of the very good. Clark has to say, but it's not just a boric and it's not specificity just. Clark has to say, let's see. Leucorrhea profuse, thick yellow with pain under left ribs. Again, the pain under left rib. You might be thinking, yeah, she has overalgia. Na? Yeah, she has overalgia. It is on the left side. So you can generalize it also. When it says left ovary pain, overalgia, it can be anywhere in the left. So when you see left-sided remedies, Cionanthus is there. And leucorrhea, it also has leucorrhea. So you see on a pathological ground also, symptomatic ground also, miasmatic ground also, it also has a tinge of psychosis. It also has leucorrhea, which the patient was having earlier. And what happens here? After giving this, better altogether, less discharge, not nearly so distinct. And this was a wonderful record. Wonderful record. So once the organ remedy was given, along with that, then again he intervenes with Merck. And now what he says. And one of my reasons for giving this was because I had observed in several cases, the patients taking it in moderate trituration have put a good deal of flesh. So here he gives Merck med. Why? Now after Cionanthus, the patient got really better. Distension went down, pain went down, altogether is fine. But just imagine a patient, now this is also a master stroke remedy, a patient who is on complex disease and she's suffering so much. Okay, there was a time when she became obese, but again then she deteriorated. The body gets weakened. You need to help the patient to give a nutrition. You have to boost the cells with the nutrition. to grow, to give them strength. And here, hence, the role of biochemics comes. Here, the role of supplements come. You have to think about. I am not saying you should pop in the pills, but you have to look into the vitamins, what are not available in the body, the calcium, the B complex, the vitamin D's. You have to supplement it properly. You have to take care of the diet. All those aspects, when you take care of, to address nutritionally also, it helps. According to Burnett's understanding, Merck is a remedy where syphilitic background and you want to give flesh to the body, like you want the patient to increase his weight, but it is syphilitic background. Mercury is the remedy. And there's one more remedy in our Mater Medical like that, hydrustis. Please go and read tuberculinum. In the relationship, you'll find out hydrustis, it is written, to fatten tubercular subjects. To fatten tubercular subjects, hydrustis should be given in mother nature. So if tubercular child comes and weight is not increasing, and you want the child weight increase, is becoming very weak, you can stop everything and give mother tincture, hydrustis. That's what Allen says in organic dose, mother tincture. So these two remedies now I know. Syphilitic background, weight has to be increased, strength has to come, muscle has to go, flesh has to come. Merck. Tubercular background, I would give hydrustis. That's why hydrustis is said to be a nutritive remedy. Hence, Merck is also a nutritive remedy. If you want to use it, use it. You don't want to use it, don't use it. But let's learn these remedies. It might help you soon. Patient has fattened considerably on this prescription and now weighs 9 stone. So patient weight increased. Complicated cases. So much suffering is happening. Weight increase is a very good thing. Like in a cancer patient, if weight is generally increasing, it is said to be a very good sign. To continue the same remedy, but in 5th, trituration. January, he gives parenteral cubensis. Seems to have set up some violent inflammation in the tumor. Sodium chloride. Pain in the night, dreadful. Discharge much. The tumor is much smaller. Then he comes with variolinum. Leukorrhea is very bad and contains some blood. Sodium he gives. Face quite, I'm not going into deep now. Now you understand why he is giving this. He's still in contact with patient. All these remedies are basically, other than variolinum, basically chicken pox. You might have found somewhere. That's why variolinum might have been used in the past. It might have found like an ozone remedy, but other remedies were basically given on the basis of totality. So a lot of people say that you give single dose, single remedy, don't touch the patient. I am not an advocate of that. I will want my patient to call me for anything. He gets urine problem, he gets fever, he gets cold, cough, anything he gets. Because I want to treat it with homeopathy. He goes and takes azithromycin or other antibiotics or painkillers and paracetamol. It is better he takes my medicine and gets his acute down. Because more and more I give homeopathic remedies, even for his acutes, I increase his immunity. I actually strengthen the vital force. So I am not an advocate of people who say that give a constitutional remedy, then wait and watch. He gets acute, what to do? Take allopathy, no problem, but don't change the remedy. It is a bullshit crap. I don't believe in that. You are harming the patient. You're saying you take allopathy, but don't take homeopathy. How much unsure are you about your remedies and about the homeopathic principles? Face quite clear. She's very much better. Tumor has gone down a good deal. Again, he gives Merck. Skin of the face is now normal, but there is still a good deal of burning in the swelling, which is, however, again much smaller. And then he intervenes with Tuja. Considering herself quite well, he stays away last month, comes now because there are few pimples and some pain. Sodium chloride, natriumur he gives. Being so much better, has become irregular in attendance, but since last August, she has had variolinum from me with much advance. With much advantage. Tumor has quite disappeared and she now comes for a cough. On the totality causticum, cough is gone, Now sites of the pain again feels raw. Close examination. One still finds a rest of old tumor at the lowest part near the groin. Again, he gives syphilinum. Wheezing cough worse, sorinum. Sorinum. And men said, whatever you do, whatever the case it is, it might seem bimiasmatic, single miasmatic, but everything starts with Sora, ends with Su. So you have to intervene. I was waiting why he has not given soric remedy. Anti-soric, why he has not used sulfur, sorinum? Why has he not used? If it was my case, I tell you, frankly speaking, I would have sometime used anti-soric and it would have really done well. Rima Hadley's last letter of Hahnemann you should read, where specifically Hahnemann talks about that how Sora is really important and so dangerous. You cannot leave the patient like this, even if he's improving. At the end, you should finish the case with Sora. You can approach, you can listen to my miasm lecture and you'll get a brief understanding about what I'm speaking from Hahnemann's point of view. Cough went away, patient has also stayed away till now. Left ovary still troubles her. The pain is very bad again, and now the worst after sleep. So, tumor is now gone, but the pain is there. Patient has left the treatment. This happens. But again, she comes back. When she urinates, she passes stringy whites. What is the remedy? What do you think? Worse after sleep. Stringy whites. What do you think, my friend? I told you, syphilinum, night aggravation. Daybreak, medorinum. Go and read medorinum aggravation, Alan Schema. So whenever daybreak, anybody says, as soon as I get up, I get aggravation of my symptom. That is psychosis, medorinum symptom. And passes stringy whites, leukorrhea. Again, psychosis is coming up. The monster is not gone. You have to keep battling with it. You have to keep fighting. Medo 30, psychotic. What happened? Hay fever. Just a minute. Okay. Has hay fever. Never had it before. She says, I never had this fever. First time I'm getting this. Good sign, bad sign. Definitely a good sign. Much sneezing. Gets an hour, sneezing, rising, washing, brings it on. She's very much better in hypogastric region after pain, sleep pain, particular. He repeats. Really. Rather, I would have done nothing here because when we are dealing with such a bad pathology and cold cough fever comes, I'm not much worried about it till it is really bothering. I want the discharges to come. I want him to sneeze. I want him to cough. I want his fever to go to 100 and 102. I don't want to suppress it because that's how the law of cure. Maybe sometime I will talk about that. Law of cure is inside out, above downwards, more important to less important organs. So when externalization is happening, discharges are happening, I'm very happy. That's the real cure. Symptoms of high fever still persist. Then on totality sorinum comes loud, noisy cough. Okay. Totality osmium. Cough soon. I'm just going fast with this. Osmium. Patient has called upon me few times since day for colds and pains in sides, but these yielded to the treatment of precisely the same nature as already described. She has had no return of tumor. The womb has long since returned to its normal. So when the pathology improves, the patient can keep coming to you with acutes. Cold, cough, fever, cold. Don't worry. This is the problem. And they go for cold and cough to an allopath. Cold and cough is externalization. It is happening. It is coming out. They will go and take allopathy and suppress it. Again, the disease will go back into the organs. So that's what I say. Please treat the patient. Maybe every follow-up you are changing the remedy as an acute remedy, or maybe every time he's coming, different remedies are coming up. Ailments from is different. Read, maybe, we'll talk about handling acute. I will do a series on acute remedies, how to deal with acute cases. So we'll talk about that. But yes, treat it homeopathically with whatever method it is. Middle of 1890. See, the case started in 82 and we are in 1890. Sorry, 86. 4 years. 4 years. Patient remained. People will ask, patient remained with you? Yes, I have got patients for 5, 5, 6 years. They're still with me, stable. You know. Then 1890, saw patient and learned that she continues. 92, patient continues. Well, I can find no trace of tumor. She came to date for me, flushes at my request allowed me to examine long treated, finally cured tumor. Thus, it will seen that my observation of this case extends over 10 years. It's not just 1 year, 2 years, 10 years and 3 months. Long for long. Now at the end, now at the end, I want to read something from this book, Burnette Tumors, the same chapter, and he has something to say. So one way is to understand the case, the remedies that is given. But people say that what Burnett does, we don't understand. I don't agree with that. If you read diligently, even in the case between excerpts are given, after the case excerpts are given, understanding is given, everything is given. You just have to wait and watch and diligently have some faith and understanding. So I'm going to read something very important, very important. Of course, the case of tumor that takes 4 years to cure. Okay, 4 years to cure and needs number of remedies to affect that cure is particularly to the uninitiated of number of great interest, of no interest, great interest, unless the subject is thought out somewhat. But if this be done, it becomes more and more interesting to the student. The more interesting, the more he knows the drugs, drug action, the phases, the causation of disease, doctrine, pharmacology. What he says, it took long time, that's okay. But if you can show students that, see, this drug I gave, the tumor gone, complex cases I cured. So slowly and steadily, it's not a fault of student, it's a fault of a teacher. Slowly and steadily, the students will develop their interest in pharmacodynamics, knowing the drug action, materia medica. It will grow automatically. Like my interest is now too much in understanding the drugs, the different aspect of it, reading different materia medica. Why it grew? Because seeing the results. A difficult game of chess can only be understood. Now listen carefully. In the beginning, I told you, treating complex cases like a game of chess. A difficult game of chess can only be understood by one who knows chess well. So to play the chess game, first you should know the rules and regulation of chess. And only man well grounded in the science can appreciate a finely played game. To the man who cannot play chess, the grandest game ever played means nothing. If you don't know anything about chess, the game, even the masters are playing. For you, it is like, oh, what they're doing is stupid. Oh, okay, take it. You get bored. You have no interest. You won't understand what's happening. So this case which I showed, I know many of them, maybe they might have left it in between. Very few would have continued, and till now you are there. Till now, very few numbers. I know that. Because people are not grounded. Doctors, homeopaths are not grounded with their philosophies. They don't see pathological cases, difficult cases. Even they see and patient doesn't get better, it's okay for them. Next patient will come in. So well-grounded person, a homeopath, will really understand what Burnett is talking and what I'm trying to explain it here. And then at the end he says, I always feel that unless we can use a series of remedies, in very difficult complex cases, such cases will remain forever uncured, or as people usually say, incurable. So according to Burnett, there are no incurable cases. He used to say more complicated, more incurable cases. Only thing is change of remedies are required. Series of remedies are required. You have to be grounded with the philosophy. The 3 philosophies of Burnett, seat of action, site of action, site of action, seat of action, range of action, kind of action. I said 4. Seat of action, range of action, kind of action. The nosode pass, the organopathic part, miasmatic, animens. When you understand the Kent philosophy, everything taken in toto, and you keep merging in with the patient. Don't leave him. Just go on and on and on and on and on to develop more wisdom, more understanding about the drugs and everything. So I think that's enough for this case, and I have divided this case into part 1 and part 2. So I tried my level best. It's a humble beginning. I'm not the master. Okay, I'm not that great to understand burnette, but yes, this physician has helped me so much. I can't tell you in my practice. And my effort is starting this entire channel is just to share what I learned, just to give a vision, because I never had anybody to show me exactly this. But there were 3 people whom I will be in depth always, from Sarkar sir, Gajanan sir, and Ashok Borkar sir. These are the 3 musketeers in my life. Because of these people, I could understand the miasm. I could go deeper into my complex cases, and slowly and steadily, because of these people, I'm able to understand burnette and trying to implicate in a very humble form in my practice. So my entire effort is to share my knowledge, whatever I have learned through my practice and through these great teachers, so that you take it ahead. You don't stop here. You take it ahead. Maybe you can do even better than us. And that's what will be the real success and real tribute to all our masters of homeopathy, all our masters, all our legends. We have immense potential in homeopathy. Thank you very much. Namaskar.